Our first guest this week is Mr. Bill Hartman. He's the CEO of Halberd Corporation. HALB is a stock symbol. Bill, always great to have you in the program.
Always great to be here, Don. Look forward to telling our story.
Well, we told part one a few weeks ago. This is basically part two. You've put out a few press releases since then. Tell us what's new at the company.
Well, Don, I'll tell you, in this ball game, you have to be flexible. You have to be able to respond to the market. You have to be able to respond to the stimulus, the stimuli. The bottom line is we started the company and we started working on COVID. We had a better mousetrap. We had a better antibody. When you used our antibody with the cocktail that's commercially out there, our antibody improved the efficiency from 65% to 94%. That's a 50% improvement. You get crickets from the industry. We then worked on Alzheimer's disease. We developed antibodies, and we were successful in eradicating 10 of the leading inflammatory cytokines responsible for Alzheimer's disease, plus glutamate. And everybody said, you can't develop antibodies against glutamate. Well, we did, and we eradicated all 11, and crickets again. So then we've decided, look, the best thing we can do is work on antibiotic-resistant bacteria. And the latest one that has gained a lot of, shall we say, attention is the Candida auris, which is a fungus, very deadly. In our laboratory experimentations using our patented process, we were able to eradicate all of the 30 strains of antibiotic-resistant bacteria and 20-some strains of Candida auris sent to us by the CDC. We eradicated those in 10 minutes or less using our procedure. So where we go from here, Don, is we've got 4 issued patents, 22 pending, and our work is extremely, well, it's gotten very, very, very busy. One of our, we're working on a nasal spray that with 3 patented ingredients that when you use the ingredients, what happens is you stop the spiral, the cascade of neurodegenerative disease formation. In other words, soon after head trauma, whether it's for the military or for contact sports, football, hockey, etc. If you use this nasal spray, you stop this cascade of events that leads to Alzheimer's, Parkinson's, etc. Now, we've started animal testing at Mississippi State University. That was done April 10th. And we don't have any results, obviously, but we're working on that. Another area where we've had to be flexible is we had developed the eradication of inflammatory cytokines that produce PTSD and suicidal ideation. At one time, around 2015, the Army was experiencing suicides of active people and reserves and veterans of 22 per day. 22 suicides per day. You don't hear that in the news, do you? Well, the bottom line is the military was very interested. We did some work with the William Beaumont Army Medical Center, and we moved on from there. And so we pulled together a proposal. We sent it to our congressman looking for some help. He tried repeatedly with the DARPA, the Defense Advanced Research Projects Agency, no response. finally they said, look, try this outfit called ARPA-H, ARPA-H. That's Advanced Research Projects Agency Health. We sat through an hour orientation with them, and they want revolutionary health ideas. So we instantly supplied 4 abstracts, and we worked very hard to do that. One on PTSD, one on therapeutic lozenge for pain, and chemical and alcohol addiction. Don, 107,000 people died last year, according to the CDC, from drug overdose. 107,000. And we have what we believe is an effective means of fighting that. And so we've submitted that. We have, of course, our work with the CDC on antibiotic-resistant bacteria. Why is that important? Smart bombs. They're obviously smart bombs could be biological weapons. We have something that could stop that. Nasal spray, that of course is the cascade of events. We're also working on 3 other abstracts. One on COVID. Our COVID work vastly superior. We did to the competition. Arizona State University working with us tested 7 leading antibodies against COVID. We had the only one that showed an affinity against all of the variants of COVID. Cancer, we did a lot of work on cancer. In the past, we did work with 72 mice the first time, 90 mice the second time, vastly superior to chemo and vastly superior to the leading anti-cancer drugs. We're reviving that work. We've been successful recently in eradicating all of the leading cancer antibodies, which are the antibodies are the bad stuff, and obviously our work on Alzheimer's and Parkinson's. So, Don, the lesson for those that are following Halberd is we've had to be flexible. We've had to, if you're not flexible and you're a 1-ball juggler, when there's a problem with that 1 ball, you're in trouble. But Halberd, our patented technology basically involves eradication of the disease-causing elements from the bodily fluids, whether it's cerebrospinal fluid for neurologic problems or blood for bloodborne. And we're actually in the process of planning to build a prototype of our system, prototype that could be implemented in a hospital environment. Seeking 7 government contracts, disease-specific contracts. It's important that we not try to sell the concept of how we do it. We've decided that we're going to sell exactly how it can be applied. And we think that's a strategic difference that's going to make a difference in the future. And at any rate, we're extremely pleased and happy. We've got a great team of people. We have people in Brazil for Central and South America. We have someone in Korea, and now we have for Asia, and we have now someone in Germany for Europe. So Halberd has, shall we say, quietly been advancing our technology. We're everything we'd set out to do. So far, we've been successful. We have found no disease elements or antigens that are inflammatory cytokines or anything that we've not been successful in eradicating. We started with viruses, inflammatory cytokines, bacteria, and now fungi. And so we think our process is, shall we say, proven itself over and over again. Now we're applying it to specific diseases. And
Well, it's amazing, Bill. You know, you're the easiest interview in the world because I just ask you one question and you go forever, which is great because the company is doing tremendous strides forward. The one word you keep using is eradication, which is amazing. Again, the company's Halberd Corporation, HALB. Bill, we're going to need a part 3, I guess. But just great progress. Thanks so much for joining us.
well, thank you, Don. Yeah, I think a third version is going to be very good for everybody because these animal tests are just underway and they're showing real progress. And we refer to them now as preclinical tests because we're also working with a group called MDI that's going to help us, shall we say, target like a laser towards FDA approval. And we don't want to waste time and effort and money running tests that aren't necessary. So we're trying to be very laser specific. Thank you, Don.
We look forward to part 3.
Thank you very much.